I am beyond thrilled to announce that doors will soon be opening to the Wholesome Fertility Method online program. If you've been listening to this podcast, you know that I love to infuse meaning and spirituality into my practice, and I'm so excited to be sharing this program that I have put my heart and soul into. I have left no stone unturned with the creation of this program. This course includes everything that I provide for my patients, including how to understand your charts from a Chinese medicine perspective, detox recipes and protocols, simple and easy ways to go clean on products and cosmetics, research-backed nutrition that has been shown to improve fertility health, fertility-boosting supplements and herbs, breathing exercises, bonus fertility yoga videos, techniques to awaken your innate power to heal yourself, and what answering your sacred call really means. My deepest intention with this program is to empower and inspire you to align with your highest self. I will be offering both independent study as well as added coaching, which has limited spots available. If you're interested in getting on the waitlist, then don't wait. Visit www.thewholesomefertilitymethod.com now, as doors will only be open for a limited time. You will not want to miss it. Episode number 60 of the Wholesome Fertility Podcast. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist, here to provide you with resources on how to create a wholesome approach to your fertility journey. My guest today is Dr. Alice Domar. Dr. Domar is a health psychologist who focuses on the application of mind-body medicine to women's health issues. Her research focuses on the relationship between stress and infertility, with a focus on the impact of cognitive behavioral interventions, as well as access to care and patient retention. She is also a practicing psychologist and does individual, couples, and group therapy. She is the executive director of the Domar Centers for Mind-Body Health, the director of integrative care at Boston IVF, and an associate professor of obstetrics, gynecology, and reproductive biology part-time at Harvard Medical School. She is a past chair of the mental health professional group at ASRM and an editor of Fertility and Sterility. Dr. Domar is on the board of Parents Magazine and served 10 years on the board of Resolve, the National Infertility Association. She is the narrator of the DVDs Stress and Relaxation Explained and Infertility Explained. She is the author of 7 books, including Conquering Infertility, and the co-creator of the apps FertiCalm and FertiStrong. She is an editor for the new textbook coming out in 2020, Patient-Centered Assisted Reproduction: How to Integrate Exceptional Care with Cutting-Edge Technology. So welcome to the podcast, Allie.
Thank you.
So tell me about your interesting, you have such an interesting background, and I'm really, really excited. I've been really looking forward to having you on. We'll start out first, though, because I know you've been influenced by your mother's fertility challenges. So can you share how that eventually led you to what you're doing today?
Sure. Yeah. So interestingly enough, I think it took my parents 7 years to conceive my older sister, and then another 5 years to conceive me. Interestingly enough, I think with my sister, my mom went through everything they could do, and this was in the 50s, so I don't know how much they could do. And they finally gave her the equivalent of Valium. I think they decided she was just too freaked out, and they gave her Valium. Boom, there came my sister. And then when it was time for me, it turned out she was ovulating, I think on day like 24 or something. And so as soon as my parents apparently had sex on day 24, I came along. And my mom talked about it my whole childhood, about how isolated she felt, about how my father would not talk to her about it. He was not at all emotionally engaged in having babies or having another baby. And she felt completely alone. And of course, in those days, people were having, 4, 5, 6 kids. And it was awful for her. But interestingly enough, when I look back, the neighborhood I grew up in Concord, Mass, was an extremely kid-oriented family neighborhood. And thinking back, there were two couples who lived across the street from us who didn't have children. And
Right.
now I realize I'm sure they actually probably had infertility. And as a,
Right.
we weren't, it wasn't something anyone ever talked about in those days. But my mom talked about it a lot.
So your mom was open about it, even though back in the day, it really wasn't. It didn't have that much of a platform or a lot of resources.
There was nothing. I mean, they were living in Baltimore the whole time she was trying to get pregnant with my sister and me. And then my dad, who was a professor, he was an economist, had a sabbatical in California 5 years apart. And it was a doctor in California that figured my mom's infertility out both times. And so she talked a lot about it. And in fact, with her pregnancy with me, it looked like it was a twin pregnancy, and she lost the twin because she
Oh,
had an
wow.
insane amount of bleeding, and that was before ultrasound. And the doctor
Right.
said to her, "You've miscarried," because I guess she must have passed some tissue. And she goes, "No, I know I'm still pregnant." I think he said, "You've miscarried. We're going to do a D&C." And she goes, "No, I know I'm still pregnant." So, sorry,
Oh, that's
there's the dog.
interesting.
Uh,
Yeah.
so, and I remember once I got into the field, I said to my parents, I said, Mom, you clearly had a twin pregnancy and must have miscarried my twin. And I think that upset my father. But,
That's wild.
yeah, yeah. But, he was not, it was really interesting. The only time, and this is a bit of a racy story. So tell me if should I not tell you a racy story?
Well, I don't know that many kids are going to be listening to this, but
Okay.
as long as it's not anything too crazy.
Because my dad was Russian, and he was a econ professor at MIT, and he was very formal, and he never talked about his feelings or anything. And I remember when I was about 12, out of the blue, he said to me, I was so happy when your mother told me that she was pregnant with you. And I'm like, wow, that's so unlike my father to say. And then he kept on talking. He goes, yeah, he said, I was so sick of having sex every other day. And when you're 12, you do not want to hear that from either.
No.
So that was the only time that I can remember him bringing up the infertility.
Oh, that's an interesting thing to say to a 12-year-old.
Yeah.
Wow.
Yeah. But my mom talked about it a lot. And when I went into the field, I think she felt that she was a social worker, and, she grew up with a brother who was brain damaged at birth. And so her field, she was a social worker, and she worked with the families of mentally handicapped children. And so clearly her childhood influenced her career choice. And I think she was very happy that what happened to her influenced my career choice.
Interesting. So it's kind of like running in the family.
Yeah.
And,
Yeah.
and it's interesting too, because, this is back in the day when people didn't talk about it, but your mom still talked about it, and
She
she
talked about it
acknowledged
much
it.
more.
And
Yeah.
I'm sure her training.
It was very scarring to her.
Yeah, I bet. But she still acknowledged it, which is amazing, considering the fact that she was going through this at a time where nobody talked about it.
Well, it was interesting. I was on the Resolve board for 10 years, and I went to the gala, the fundraising gala, Night of Hope, earlier this week. And the person who won the big award, the Barbara Eck Award for doing the most to Resolve, was Risa Levine, who's been on the Resolve board now, I'm thinking close to 10 years. And she pursued every avenue of treatment and was unsuccessful. And she's been very public about her journey. And she's now, I don't know how old she is, but she's, obviously past the point where she can get pregnant. And when she was giving her acceptance speech, and, people it's online, she actually said that she wakes up in pain every morning. And I it's been at least 10 years since she tried. And that's exactly what someone like me would try to prevent. Because, my mother, even though she ended up with two healthy genetic children, it's clearly scarred her. And it worries me that, there was a study that came out of Sweden that tracked people for 20 or 25 years after infertility. And even those who had children still did not test like fertile people. And those who never had children obviously tested, very differently. So I think
And what was the test
it was,
exactly?
it was, depression, anxiety, quality of life. Um,
Mm-hmm.
and as a psychologist, that's exactly what you don't want to see. You don't want to
Right.
see somebody 20, 25 years out who's still suffering.
Absolutely.
I mean, that to me is a tragedy. And so, I work with patients who, when it comes to the point where it's obvious they're not going to be able to get pregnant with their own eggs or their own sperm or their uterus, you've
Mm-hmm.
got to do some, you got to really dive deep into how to make sure that person can end up with a good quality of life.
Absolutely. And there's also a comparison to PTSD for people who are going through fertility challenges.
Absolutely. I mean, I published a paper about 20 years ago, and I probably cite this paper once a day when patients apologize to me for how upset they are about going through infertility. And I said, I published a paper years ago that showed that women with infertility had the same level of anxiety and depression as did women with cancer, AIDS, or heart disease.
Wow.
So that, just to show that, when I say to patients on a daily, in fact, I was training one of our physicians yesterday that if a patient says, I'm miserable, the answer is, okay, you're handling infertility in a perfectly normal way because it's really,
Right.
really hard.
That's a major validation because I think a lot of women, especially before they go to get any professional help or talk to anybody, all they have are the people around them that don't really relate. Not all of them do. I mean, it's very, very uncommon that they're going to find somebody who understands exactly what they're feeling. And the first thing is they probably feel so alone. And a lot of times I've seen, and I mean, obviously, you're the professional in this matter, but I've seen and heard from my perspective, a lot of men have a very, very different approach to fertility challenges than women do.
But I think we misunderstand men
Mm-hmm.
that, and again, I think it's going to go back. In fact, I was just talking to someone about this last night. I think men of my father's generation and my generation um, didn't talk about their feelings. And I think that,
Mm-hmm.
when I was first trained and I first started seeing couples, the men would be very stoic and, just say, I'm here for my wife. I'm going to be her rock, whatever she
Mm-hmm.
wants to do. And, you're now fast forwarding and you're, talking about a lot of the people we're seeing now are millennials. And, the
Mm-hmm.
research coming out now, you know, yeah, the men are not yet testing in the same range as women. But a researcher from UCSF, Lori Pash, published a paper a couple of years ago, which looked at the depression and anxiety levels of men and women in treatment. And about a third of the men reached the psychiatric level of depression, and over half reached the level of anxiety. So
Oh, wow.
I think that it, maybe in my dad's day, he was so invested in his career. I don't know if he cared that much if he had kids, but I
Mm-hmm.
think in the last 30 or 40 years, I think men have very much cared. They just didn't feel it was appropriate for them to express it. And I think men now are more likely to. I think it's much more socially acceptable for a man to say,
Mm-hmm.
hey, I'm really upset.
Right. Well, it's great to see that we're actually progressing, and
Yeah, we are.
and
Oh
they
my
have a
God.
platform or place.
I mean, I think I'm the one who's constantly bashing social media in terms of
Hmm.
the impact it has on all of my patients, not just my infertility patients. Sorry, the dog is barking. I don't
Oh, that's okay.
I don't know what she's barking at, but she's barking at something. But I also think that one good thing about social media is that I think people, in their 20s and 30s now are much more able to talk about when they're unhappy or upset or depressed or even in danger,
Right.
which I think is, from a mental health point of view, is a really, really good thing. And so I'm seeing far more husbands now than I did 20 years ago.
That's great. That's really amazing. So, can you talk about your research, past and recent? Because you had mentioned having some recent research as well on the mind body influence for with fertility.
Yeah. So started a long time ago. So in fact, I think,
Yeah.
I started the Mind Body program in 1987. And so my first baby is what, 31? I mean,
Hmm.
from the very first program, who was supposed to be a girl and was supposed to be named Allie, and his name is Timothy, which still breaks my
Hmm.
heart. So I started the Mind Body program when I was a postdoctoral fellow. And after the first year, was realizing that a fair number of the women in the program got pregnant despite years and years of infertility. And after 2 years of this and realizing about a third of the women got pregnant, I thought it made sense to do, a randomized control study to see if, in fact, the Mind Body program led to increased pregnancies. And so I submitted a grant to the National Institute of Mental Health, and they came back to me and said, well, we're not going to fund a randomized controlled trial because you have not proven that women with infertility are more depressed than fertile women. I mean, this is back in the
Mm. Oh,
late
interesting.
in the late 80s, and that really annoyed me because at that point I was pretty actively running Mind Body groups, and it was
Hmm.
very clear that infertility patients were very depressed. But anyway, so NIMH gave me a ton of money, and I did a study where I compared the depression levels of women with infertility, and I compared them to women who I think were coming in for pap tests. And
Hmm.
indeed, women with infertility were far more depressed than women who were,
Hmm.
didn't have fertility issues, which was, that was a no-brainer. And so
Right.
after that, the NIMH said, okay, now we'll fund you for a big randomized controlled trial. So we did a randomized controlled trial in the Mind Body program and found the pregnancy rates were twice those of women who didn't go through the program. So it was like,
Mm.
wow, we're really onto something here. And so I spent, many years developing the Mind Body program, doing a fair amount of research on different interventions, and then did a second randomized controlled trial. That would be 8 years ago. That was actually funded by Johnson and Johnson, strangely enough, looking
Hmm.
at the impact of the Mind Body program on women starting IVF. And we found again that women who were doing IVF, who did the Mind Body program, more than doubled their pregnancy rates. So it
Wow.
was pretty obvious that doing some kind of major intervention, and I have to say, the New York Times, I think tomorrow is coming out with a piece on the relationship between stress and infertility, and you know they very much have the position that stress has no impact on fertility.
Right. Right.
And I was trying to, counter that politely with the reporter, but it is a myth that just relaxing you'll get pregnant, because there are lots of women who are not relaxed, women who are concentration camps, and women who are raped, and women who just
Hmm.
don't live in safe environments who get pregnant. And so
Hmm.
relaxation per se does not cause pregnancy or does not cure infertility. But I
Hmm.
think if you accept the theory that in some women, stress can hamper reproduction and thus, decrease the efficacy of treatment, if you then, in a very intensive way, work with her to give her coping skills and change her health habits and give her support and teach her relaxation techniques and reduce her stress, all of that together does seem to be associated with an increase in pregnancy rates, in addition to a massive decrease in psychological symptoms.
Which by itself, I mean, to not have to live with torture or depression, an increased quality of life,
Mhm.
that by itself is such a gift.
Well, it's interesting because, in the current Mind Body program, it's now been going on, as I said, for what is it, 32 years. Um, we probably have about a 50% pregnancy rate within 6 months. And so we have to be aware of the fact that half of the women who go through the program will not get pregnant right away.
Right.
And so it's really
Right.
important for them to realize that the purpose of the program is not pregnancy. The purpose of the
Mm, yeah.
program is for them to get their life back, so that they
Right. Oh,
feel
that's
like,
such a great reframe.
well, it has to be, because
Yeah.
you know
It's a responsible way.
right, if their stress level and or their lifestyle habits are getting in the way of their fertility, then
Hmm.
a program like the Mind Body program might help them get pregnant. But if there's
Right.
a severe malfactor or blocked tubes or poor egg quality, they can do a Mind Body program every night for the rest of their life, and there's no way
Right.
it's going to impact their fertility per se. The one
Yeah.
thing I would say is that, and that's in fact what most of my research is now, is on why patients drop out of treatment.
Mm-hmm.
Stress is a huge factor in that. And so if you can reduce someone's stress to the point where they feel able to undergo treatment, then they're going to get
You
pregnant.
mean by IVF treatment?
Any treatment.
Any treatment.
Any
Yeah.
treatment. Um, if someone has been trying for a long time, they're very unlikely to get pregnant without treatment. And,
Right.
and if someone does one IVF cycle and finds it really stressful and drops out, they're unlikely to conceive on their own. They're much more likely at that point to conceive with treatment. And
Mm-hmm.
I was giving a talk a couple weeks ago to a group of healthcare grand rounds at one of the hospitals in Boston, and I said to them that, and I'm in Massachusetts, where there's a state mandate for 6 IVF cycles per baby, and so people have insurance coverage here. So money is not the reason why people drop out. And I
Mm-hmm.
said to this group of physicians, I said, we are providing a treatment that, procreation is the strongest instinct in the animal kingdom. Like, females of almost every species will die to protect their young, and males of most species will, kill to be able to mate. And so we're talking about an extraordinary instinct. And so if you look at people with infertility, they really, really, really want to have a baby. And yet
Mm-hmm.
so many of them are dropping out of treatment because of the stress of treatment. And so I
Right.
said, and I'm giving talks across the country now to say, look, guys, we need to change the way we care for patients.
Yeah.
Because if the way we deliver care, or the care or the treatment that is being administered to patients, is so burdensome that people are
Mm-hmm.
dropping out before they get pregnant, we need to change the way we care for patients.
I agree with you 100%. I've had patients come to me. I've heard so many stories, and they felt like they weren't really seen as a person. It was like
Yep.
almost like a number or a
Yep.
name, or it was just there was and then different practitioners would tell them different things, and there was no
Mhm.
communication. And they would say, "Wait a second, one person told me to do this,
Mhm.
and now you're telling me to do that." Like there was no communication. Um, they just felt like inhuman,
Yep.
and it was
Yep.
really sad to hear. And they said every single time I go to the doctor, I come out feeling so defeated,
Yep. Yep. And
and
that's
it's very
universal.
unfortunate.
That's universal. I mean, there are some clinics, or especially the smaller boutique clinics,
Yeah,
where people know every patient, but there's so many conglomerates now. There's so many clinics being bought up by, venture capital groups and private equity
it's like a
groups.
corporation.
It's
Yeah.
becoming more of a business, and so
Yeah.
I think you can provide infertility care in a way where nurses are well compensated and physicians are a good living and everything else, but you can still care for patients. And so about a month ago I was giving a talk, I don't remember where I was, and it suddenly, like, a light bulb went off, and I said, we're always talking about treating patients. Like, all the lingo is always, oh, we're treating this, we're treating that. I said, can we change it? And instead of saying we're treating patients, can't we just say we're caring for patients? and and,
Yeah.
and that just should change your whole mindset. You look at a patient, and yeah, she might need medication, or she might need surgery, or he might need some kind of intervention. I'm sorry about the dog.
Oh, that's okay.
But we're caring for them, and we're trying to help
Yeah.
them. And so, a study came out about, I don't know, 3 or 4 years ago, out of Spain, where they did an assessment of patients' assessment of quality of care. And the patients assessed the care as pretty poor. And so they took the physicians from the practice. And I don't know how they did this. They actually made them go to a weekend retreat where they were trained in empathic communication skills,
Hmm.
like how to talk to patients with empathy. And then I think a month or two later, they reassessed patient perception of care, and it skyrocketed. And so,
Wow.
so now I'm trying to train physicians and nurses across the country
Oh, that's
in
amazing.
how to communicate empathically. So I just yesterday, I'm doing a research project with one of our fellows, and
That's amazing.
I was teaching him how to have a conversation with a patient in an empathic way. So, one of the examples that really stuck with him was, physicians often say, "Oh, I know how you feel." And I'm like, actually, you don't. Unless you've been through infertility and you've just failed your third IVF cycle, you don't know
Right.
how
It's
to
almost
feel.
insulting to hear
It's
that.
totally insulting. You
Yeah.
can say, I'm sure this is excruciating for you, or I know this must feel really frustrating, but don't say I
Right.
know how you feel. No one should say that
Right.
unless they've been through it.
Yeah, you're right.
So that's
Absolutely.
my campaign now, is to try to train physicians and nurses how to communicate with their patients.
It's amazing that there needs to be a training like that. Because as humans, you would think that we would have that, but it's interesting, that some people need to learn how to communicate. But I think that what you're doing is amazing because it's so necessary. And women and men, they need it. They need to hear when they're going through something like this. They need that, I think, more than anything else. And
Hmm.
and just like you said, 50% is a huge amount, to have that mental well-being change
Yeah.
your physiology
Yep.
to that degree.
Yep.
I feel like it's got to be probably number one priority, before anything else, before any physiological standpoint. And what I was going to ask you is we know that like about 50% do better. What what do you think actually happens to the body when a person starts to feel mentally well? Like what is your understanding of that?
Well, if you look at the animal model, if you stress out animals, they stop reproducing. Because if you think back to caveman days. If
Hmm.
if a caveman or cave woman was in danger, was being chased by saber-toothed tigers regularly, or didn't have enough food, or didn't have a cave to sleep in, it would
Hmm.
really not be a good time for her to get pregnant. Because
Yeah.
if she's being chased by a saber-toothed tiger on a regular basis, if she gets pregnant, she's going to get fat and slow, and so she'll die.
Right.
And so it's not a good time. So you know you know all species have sort of this built-in mechanism that if conditions are not good for
Hmm.
pregnancy, let's not get pregnant. It's too much. And
Yeah.
so that's there's so much of our brain that goes back to the lizard days. So there is a physiological mechanism there. And there's also the
Yeah.
fact that when people are severely depressed, that's not a good time to have a baby, because when you're very depressed, you can't take care of yourself, let alone a baby. And so it makes sense
Right.
if someone's very, very depressed that they should not reproduce. So,
Yeah.
at some level, the body is doing exactly what it should be doing. That we are all created, as I said, we've evolved from caveman days to reproduce when times are good. We should not be reproducing when times are bad, because a baby,
Yeah.
having a baby takes a huge toll on the female's body, and then having a baby takes a lot of time and attention. Once they have the baby. And so I think you fast forward, millions of years or hundreds of thousands of years, and I think the average couple decides they want to have a baby. They throw away the birth control. Um, you know, it does take the average couple a number of months to conceive. I mean,
Right.
they
Normally.
may conceive every month, but most embryos that are conceived are not chromosomally normal. So women get their periods and never knew they were pregnant. But if
Right.
a few months go by, then especially she starts to get really worried about it. And there may be endometriosis, there may be PCOS, there may be all sorts of, there may be
Hmm.
male factor. But by the time she sees a doctor, she's already probably pretty upset, as is he.
Right.
And so
Yeah.
if you started with a physiological reason for the infertility, by the time they get that reason treated, even if it's treated successfully, the stress levels at that point may be so high that in and of
Right.
itself could interfere with conception.
Right. And what's interesting is you had mentioned before, because obviously your research shows that with the mind body program, it helps, it increases fertility. However, they do say that like there's no real research that stress relates to infertility, just like you had mentioned.
No, there's a lot of research. I don't know. There's a lot of research that stress.
But some people say it's too inconclusive. that they're not. I've heard, some
Yes.
people
No,
say
there are a lot
it's
of
too
people that
inconclusive.
it's a very controversial topic. And so, I've been literally debating this with other professionals at the fertility meetings. I've done it 3 different times, where I say, yes,
Hmm.
stress impacts fertility, and they say, no, stress does not. And,
Right.
when I was interviewed by this New York Times reporter a few weeks ago about this, and I actually said to her, I said, I gave her all the data on how stress impacts fertility. And,
Hmm.
most of the data is actually from the impact of psychological interventions. And there was a meta analysis that came out a few years ago by a group of psycho-oncologists in Scandinavia that showed that, psychological interventions as a whole, not just my program, but programs around the world, um, decrease distress and increase pregnancy rates. And
Right.
so what I said to the reporter is, there've probably been, I don't know, 20, 25 studies looking at, for example, stress before the woman starts the IVF cycle to see if that level of stress predicts IVF outcome. And people have been fighting about that for a long time. Well, the fact is,
Hmm.
we're never going to get an accurate answer for a number of reasons. If you assess a woman's stress level right before she starts an IVF cycle, there are 3 potential factors that could interfere with any conclusions you come up with. One is a lot of infertility patients, when they take psychological questionnaires, fake good. They don't want people to think,
That's a great point.
you know, and we
Yes.
have data on this that patients have actually told us they don't want their doctor to know how distressed they
Right.
are. So we know
That's
patients
such a good point.
fake good. The second point
Right.
is patients before they start an IVF cycle know their prognosis. So if you're a 25-year-old with an FSH of 2 and an AMH of 8, and your doctor has said
Hmm.
to you, oh man, this is going to be a piece of cake, you're going to get pregnant, she's going to test in a much healthier way than a 42-year
Hmm.
old who has a FSH of 15, whose physician has said, look, your chances are less than 5%. And so she's going to know her
Hmm.
prognosis. And so that's going to impact it. Third reason is
Yeah,
that
it does. Yeah.
most patients, when they start an IVF cycle, have a period of feeling renewed optimism. Like they're doing IVF.
Hmm.
IVF has the highest pregnancy rates. I'm starting the cycle. I'm psyched up. And so the way she tests when she starts her IVF cycle is not actually representative of how she's been feeling for the past 6 months. It's really how
Right.
she's feeling. And so, because of those 3 factors, you cannot look at a woman's self reported psychological state before she starts an IVF cycle and use that to see if she gets pregnant, because there are too many
Hmm.
interfering factors. Now, there's been a
Right.
couple studies now looking at, um, strangely enough, cortisol levels in hair. So you can't look at cortisol levels in blood or urine because cortisol fluctuates so much. But
Hmm.
apparently, your hair, because it grows slowly, you can actually collect cortisol levels from your hair, which shows
Hmm.
overall stress levels for the previous few months. And there have now been 2 studies which have shown that hair cortisol does predict pregnancy rates from IVF. So I
Wow.
think that,
That's
I think,
we're getting somewhere.
so we're actually getting somewhere. But what I said to the Times reporter, and I was getting so frustrated with this whole piece they're doing, is I said, can we just stop fighting about and debating about and arguing about whether or not stress impacts treatment outcome? It's just a
Yeah.
stupid argument. Can't we just
Yeah.
assume that most people going through treatment are suffering? And can't we focus our
Right.
time and our energy on relieving that stress and stop having a stupid fight? And
Yeah.
I'm actually about to start writing an editorial for Fertility and Sterility, which is the big journal of the American Society of Reproductive Medicine. And I'm going to say that. I'm like, we've got to
Yeah.
stop fighting about whether or not stress impacts fertility. No one should care. What we should care about is that men and women who are going through infertility and treatment are extraordinarily distressed. And we should focus
Yeah.
all of our time and attention on treating that distress. So,
Absolutely. I mean, it's a great point. And it's just it's interesting because when you were talking about it earlier, to me, it's so logical. And what you were talking about, how our bodies are made and how our bodies respond to our environment or perceived environment. And to me, it's just so logical, but we lean on, which it's research is amazing. And obviously you do and you find a lot, but sometimes it can be conflicting, so conflicting that people depend on it not being conflicting to say that it's accurate or something's accurate.
Mm-hmm.
But the bottom line is sometimes these things are just so logical and obvious
Yep.
and they're staring us straight in the face, but we're waiting for it to be proven and everybody to agree based on their research studies, and it gets a little much. But I love what you're saying is just whatever, who cares?
It
Like,
doesn't matter.
the bottom line,
It doesn't matter.
yeah, it doesn't
No.
matter.
I mean, I've done 3 debates at the American Society of
Mhm.
Reproductive Medicine meetings with 2 different psychologists on whether or not stress impacts treatment outcome. And I was told that at the European meetings this coming July, there's another debate with 2 other psychologists debating. And I'm just sick of this. It's absolutely ridiculous. We've got to stop.
Yeah.
The media's got to stop focusing on it. Every time a study comes out showing that stress does or does not affect fertility, the media goes crazy over it. And it's like,
Right.
forget it. It doesn't matter. If it turns out that stress does impact fertility, you're blaming the victim.
Right.
And, why can't we just focus on developing tools and strategies and classes or whatever it takes? I've seen women, one of the best parts of my entire career, maybe the best part of my whole career, was running my body programs. And I don't run the groups anymore because I travel too much. But you start these groups, and when I used to train psychologists, and they would sit in a group with me, and you'd sit there at the first night with 16 women and their partners if they have a partner, and the 16 of them and the partners are messes. I mean, you have to bring a box of Kleenex because they've hit bottom, and like the mind body group is like their last grasp at sanity, and they're just miserable. And literally week by week by week, it's absolutely insane. And by the 10th session, everybody's laughing, talking, friendly. I can't get a word in edgewise because they love talking to each other. It's really hard to teach because they're just too happy.
That's great.
That's what we should all be focusing on is giving them their life back and not focusing on a stupid debate.
Yeah, you're right. I mean, because it's a great reframe because you're focusing more on the well-being of the individual rather than an endpoint. Like, this is going to give you pregnancy, and then also that in general, like, gives false hope for the 50% that won't.
Exactly.
And so the bottom line is that we're focusing so much on this endpoint of attaining something rather than this moment right now and how you're living it and how the world looks to you.
It's been I'm old. I've been doing this for a long time. I hope to retire in 4 years. I'm really hoping that message gets out by the time I retire, because I don't know about anybody else who's sort of going to take up the gauntlet. It's frustrating for me. I've been doing this for over 30 years, and I still think people are fighting about the wrong things.
Yeah. But isn't that the case with everything? And but I do love the fact that you have a lot more of an aware approach, and I will continue this fight for you because I'm working with fertility patients and I do acupuncture and I also include hypnosis, and I'm very big on well-being. And I love the way that you're saying it, and it's actually inspiring me to have that conversation right from the beginning, because my first thing is I'm fighting to try to get these people pregnant, the couples pregnant. And that becomes like also my goal as a professional. And I do have the conversation, but probably not enough. I need to talk more about just really getting your life back regardless.
Well, I worked with Herbert Benson for 17 years. He's the cardiologist who came up with the relaxation response, and he's probably the father of behavioral medicine. And he used to give talks, and he'd say that healthcare is like a three-legged stool, and one third is pharmaceuticals, which could, which is medicine, vitamins, things like that. But it's pills or injections or whatever that you take, and one third is interventions like surgery and procedures that are done to you. And the third leg of the stool is self care, and it's
Right.
things that you do for yourself to help yourself become and stay healthy. And I
Yeah.
think that's something we have to keep in mind. And, one of the things that has sort of taken Europe by storm and has not really hit the US as much as I would like is this whole
Mm-hmm.
concept of patient centered care. And so
Mm-hmm.
one of the big three pharma companies has had me do a non branded talk for physicians and nurses and clinics all over the US on what patient centered care is and why it
Mm-hmm.
needs to be applied to infertility care. And it's not,
Mm-hmm.
it's not based on the clinic's needs or the doctor's needs or the nurse's needs. It's based on what the patients need. And interestingly
Right.
enough, I'm the senior editor of a textbook coming out in the spring by Cambridge University Press, and it's the first textbook on patient-centered ART. So it's, how can all three,
That's great.
how can all three, how can, IVF, how can the lab, how can nursing care, how can all of those things become patient-centered? And I,
Right.
it's starting to happen. I think millennials are demanding a different form of care. But again, we need to start caring for patients. And I think patients need to feel empowered. They need to feel in control. They need to feel part of the process. They can't feel like a number.
Absolutely. I'm with you 100%. It's so upsetting. It really is. It's frustrating to hear that people are going through this all the
Yep,
time.
every day.
It's
We have
crazy. And so go ahead.
we have this we have a bunch of programs at Boston IVF that I've started in the last few years, and one is that every patient who's had an unsuccessful cycle can have a free half hour with one of the psychologists. And half hour is not a very long period of time, and so in effect, it takes 10 or 15 minutes for each patient to sort of tell their story so that the psychologist
Hmm.
can get oriented. But a lot of it is just talking about how normal their thoughts and feelings are.
Right. It's that validation.
Yeah. And they feel lonely. And, like one of the things that no one seems to talk about is how awful it is when other people get pregnant. Sorry.
Hmm.
And no one talks about that.
Yeah.
Like when I wrote my book on infertility, I think I have a whole chapter on how to handle that because no one ever talks about it. The
Right.
fact is, a lot of infertility patients feel deeply ashamed that they're so
Yeah.
upset, especially if someone they love gets pregnant. And you know what?
Right.
If you lie in bed and cry for 3 days, my response is, wow, that's a perfectly healthy and normal reaction.
Yeah. And it's such a conflicting feeling because you want to be happy for the person that you love so much.
Mm-hmm.
And then you're sad for yourself
Yep.
because you can't share in that experience.
Right.
And it's so conflicting because then you're like, I'm so upset and I can't be happy and it's I've heard the same thing, I've heard a lot of people express that. And it's a big thing that you can hear about when you're in the profession, but I guess you're right. I mean, not a lot of people talk about that and give it a platform and give it the energy it deserves.
It's huge.
Yeah.
I mean, and if your sister gets pregnant or your best friend gets pregnant or, anyone that you love, you're right. The feelings are so conflicted. And, you know, I tell every single patient, you are hereby forbidden to go to a baby shower. Like, I don't care what excuse you have to give. My favorite one is
Yeah.
the morning of the baby shower, you are going to develop a stomach bug. So you can't go.
That is so liberating that you're saying this. And I'm sure there's so many people listening to this right now. I think it's great because it's okay for you to miss it. It's okay
Yeah.
for you to acknowledge
Yep.
and honor your own
Yep.
place. Like,
Just send it,
how liberating.
go on Amazon, send a nice gift. Don't go. Please don't go.
Yeah.
There's no reason you
Yeah.
have to go.
Yeah.
I mean, again, if it's someone who you know and love and trust, who's having the shower and can understand why you can't go, then you can tell them the truth. But otherwise, get some kind of contagious disease. That's no pregnant woman wants to be around someone who's a contagious disease.
Right. That's a great
You know,
point. That
vomiting is very off-putting. So that's what I said.
That's right. I love that. I love that. That is that's just such a great, it's almost a permission that they should already have, but you're giving them that
Okay, so I can
permission.
officially say everyone who's listening is officially under doctor's orders to never go to another baby shower until they want to.
Yes.
It,
Amen.
it's too painful. And you know what? It also means, don't go to first birthday parties and don't go to gender reveal parties and all the other things that people um, want you to go to. It's just too painful.
It is. So, yeah, I mean, we're talking about, because I was going to actually go into the toolbox of relaxation techniques that you mentioned. I would say that's number one on the
Yeah,
toolbox.
I would say also. I mean, I would say learning to protect yourself is 1 through 10.
Yeah.
Not going to these showers. If someone says something insensitive to you, I mean, you know, these apps that I helped created, we have these scripts for when people say stupid things to you. And so what I tell my patients
Hmm.
is, think about the things people say to you that bother you the most and memorize snappy comeback lines. Because I'm the kind of
Hmm.
person that if someone says something hurtful to me, like 3 days later, I think, this is what I should have said.
I know.
I don't think I would repeat.
We've all been there.
Yeah, and so I think when you're going through infertility, the things people say that bother you the most. So
Yeah.
memorize things that you can say in response. And there are 3 levels of responses. One is polite, like, oh, thank you, or, thank you for telling me, or whatever. The next is educating them. Like, well, actually, no,
Hmm.
just relax and you'll get pregnant, or just adopt and you'll get pregnant is a myth. And the third one is actually my
Hmm.
favorite, which is I call the zinger. That if someone says something to you and you perceive they're being rude or intrusive or they're trying to just be obnoxious, zing them right back.
Hmm. Yeah. I like that. The zinger is powerful.
Yeah, unfortunately, when the pharmaceutical company Ferring, which licensed the apps for a couple of years, they took out all the zingers because they felt they were inappropriate. And my
So these are the apps for FertiCalm and
yeah,
FertiStrong?
so what we did, Liz Grill, who's the chief psychologist at Weill Cornell Medical Center in New York, she and I came up with this idea for these apps, and we came up with the 50 situations, which in our combined 50 years of experience or whatever it is, we came up with the 50 situations which cause our patients the most stress. Like being at a family
Hmm.
event and someone announcing a pregnancy, or being at work and getting negative pregnancy test results on over the phone, things like that. And so for each
Hmm.
situation, there's 6 cognitive, behavioral, or relaxation things you can do that second to feel better. And one of them is, it's called social solutions. And we have a line of someone saying something stupid, and then
Hmm.
scripts of what you can say, polite responses, educational responses. And we used to have zingers, but their regulatory department thought the zingers were too crude. I wrote them all, so I know they were crude. uh, but someday I would like to put them back, because I think that sometimes you do need to zing people back.
Yeah, I agree. It's amazing to me too because I feel like in normal states, when you're actually living your life and everything's fine, people don't say stupid things. I don't understand why people say like the worst possible thing when you're down. It's crazy to me. It's crazy to me.
Well, my husband calls me a pathological optimist, and I
Hmm.
would like to believe that most people are not cruel. I would
Hmm.
like to believe that these comments that people are making either reflect that they're really uncomfortable with the topic and they just say stupid things, or they're
Yeah.
trying to be helpful. I think sometimes people are competitive. I've had so many patients talk about siblings saying and doing really horrible things. And,
Hmm.
I truly believe that sibling rivalry never dies. And, you
Yeah.
know, but oh, come on, Carly. I'm on. Stop. The dog is very protective. Um, I like to believe that most people don't mean to be cruel.
I don't think so either, but it just amazes me. I guess I'll just say it's stupidity,
Yeah, or,
of the comments
or
sometimes. It's
ignorance,
just I can't even.
or ignorance. I mean,
Yeah.
I've been doing a lot of seen a lot of patients lately with pregnancy loss, and we just did a free pregnancy loss webinar for women who at Boston IVF who had a pregnancy loss. A physician and I did it together. So I've been talking a lot about patients with pregnancy loss, and it's just extraordinary the things that people say to them.
Yeah.
When someone loses a pregnancy, or I mean, doesn't lose, when someone has a miscarriage after,
Yeah.
especially after infertility treatment, that is catastrophic. That is a
Yeah.
death. It's a
Absolutely.
death that needs to be treated as such and mourned as
Mm-hmm.
such and given space and time and support. And our society is so uncomfortable with miscarriage.
Mm.
It's just shocking to me, and I remember my sister had a miscarriage, her first pregnancy, and she had told the whole world that she was pregnant, and so she of course then had to tell the whole world she had miscarried. And she said it was a really, really good thing because she had friends coming out of the woodwork who had had a miscarriage that she had never known. And then I ended up having a miscarriage in between my two children. And I also told the whole
Mm-hmm.
world I was pregnant and had to tell people.
Right.
And, I had a good friend of mine who told me that she had lost a baby at 16 weeks, which I had never known. Because people
Wow.
don't talk about pregnancy loss in
Yeah.
our society. And I was looking at CNN the other day, and I don't remember what Hilaria Baldwin, Alec Baldwin's wife, who had a pregnancy loss, I don't know, 6 or 12 months ago, just announced
Mm-hmm.
she had a miscarriage at 16 weeks.
Mm.
And I know she has a bunch of kids. I think she has 4 kids. Um, but God bless her for being
Yeah.
so public.
That's hard.
It is. I mean, she's very much, and she actually says we are not okay. This is
Yeah.
awful. We are. And the headline was "We are not okay." And
Wow.
I wish there were more celebrities who would, and more of them are coming out now and talking about infertility and how hard it was. Um,
Yeah.
we need more. I remember when a woman was diagnosed with breast cancer, she didn't tell a soul. When I was a kid, no one knew when anybody had breast cancer. And then Betty Ford, who is the president's wife, and Happy Rockefeller, who is the vice president's wife, both within a short period of time were diagnosed with breast cancer and came out very publicly. And all of a sudden, people were talking about breast cancer. And now we have,
Yeah.
I'd say, like a whole month dedicated to
Yeah.
breast cancer awareness. I
Right.
wanted fertility to follow the same path.
Yeah. It's starting to. I am seeing it. And it's amazing because as soon as somebody says it, it provides such healing and such relatability to so many people. And I think as humans, and I'm sure obviously you see this all the time, I think that that's why group therapy is so important is
Yes.
to be able to share
Yep.
and know that somebody else understands where you're coming from and that you're not alone. Like what you're feeling is not, it's not isolated. It's something that other people are relating to, knowing that you can share in that even in difficulties, and know that other people are going through it too, by itself is so comforting
Mm-hmm.
and healing. Because most of the time when we suffer, we think we suffer alone. Like we feel alone in our suffering.
Well, I actually think that's the group component of the mind body groups is one of the strongest reasons why people heal emotionally. You feel so isolated, and you can literally be in the mind body group, and a woman walks in and says, "I just found out my sister's pregnant for the third time," and
Hmm.
everyone in the group is like, "Oh my God, I am so sorry." Now,
Yeah, and the compassion that you feel
yeah,
from that, from each other,
yep,
is so much more
right.
genuine and deep because they get it.
Yep. This is in fact
Yeah.
when the book The Handmaid's Tale came out, I told all my patients to read it because, there you have the vast majority of the society is infertile and you're in the majority versus here where
Hmm.
you aren't in the majority. And yet being with other women where you tell a story and they're like, "Oh my God, that's exactly how I feel."
Yeah.
It makes you feel normal again.
Yeah. That's amazing. So yeah, I mean it's amazing. What you do is so amazing. I've wanted to have you on the podcast for so long because I just love the fact that you've not only done this and it's such a work of the heart for you because of what you've seen growing up.
Mm-hmm.
I love that. I love the fact that you not only did that, but you also put so much time and effort into really researching it and seeing exactly what it is that works and doesn't work, or how people respond. And I love the intention that you have behind all of it. And the intention is not to go for the goal of pregnancy. It has nothing to do with it. It's all about becoming well. It's the compassion that drives your work. And I just want to say that I think it's really beautiful. And I mean, I know that you just do it because it's just what you do. I can just only imagine how much of an impact you've had on so many men and women out there.
Thank you. That's really
I think
nice
it's
of you to say.
amazing. I don't know that you kind of stop to think about it often
Never,
because you're
never.
probably so passionate about what you do and you just do it. But like, it's a pretty amazing. I mean, you've done amazing work. Amazing.
I don't stop and think, and I really appreciate your saying that. I have a patient who probably had one of the roughest, if not the roughest, infertility histories of my career. I mean, just everything that could go wrong, things that we didn't even know could go wrong, went wrong for her. And
Hmm.
she had twins about 2 months ago. And her physician had said to me, I'm basically only gonna do one IVF cycle with her, and I'm only doing that so you don't get mad at me, because her
Hmm.
prognosis was so bad. and
Mm.
and so I saw her right before the twins were born, and I said to her, "How did you do this? Like, how were you able to, for I don't know, it was like 4 years, and God knows how much money they spent. How were you able to do this?" And she taught me. Obviously, she has an incredible amount of inner resilience. The fact that she was able to, and the family supported her and everything else. But she said she was cared for. Like, she
Yeah.
was cared for by me, and she went through the mind body group, and she was a peer counselor for the mind body group. And the physician who ended up cycling her, really, really worked to have this work, and the whole team. And,
Yeah.
on Wednesday, she came to my office and she brought her twins. And
Oh,
I was holding them, and she took about, I don't know, 10 pictures of me holding her twins, and she sent them to me. And if it was appropriate, I would actually frame one of those pictures and put it on my desk, because it's not that she has two genetic children. It just shows what one can do when you really do patient-centered care, and that you get the whole team together, and you have a patient who has developed resilience with support, and that you can
hmm.
have happy endings. And happy ending is not just a genetic child or genetic twins. I mean, a happy ending is, donor egg, donor sperm, surrogacy, adoption, not having children.
Yeah.
But we need more people to have happy endings.
Yeah. I love that. I just I love that you are saying this, that a happy ending does not necessarily mean this.
No, I have to say, I think my happiest patients of my whole career probably, or some of my happy, are the ones who did donor egg.
Yeah. Yeah. I've seen it too. It's amazing, and nobody regrets it.
No.
Even if they were fighting, kicking and fighting in the beginning
Yep.
about it.
Yep.
And a lot of them do. And then they're like, "Oh my God, it's the most amazing thing. I like, thank God I did this."
Mm-hmm.
And I
I
wouldn't have this
actually think that
particular child had I not.
in my whole career, I think of probably the top 5 or 10 patients I've had who are the most ecstatic moms. And I do see patients on and off. I mean, I'm seeing a patient now whose daughter is 16, so I've been seeing her for a long time. But I think one of the happiest people I've ever seen in terms of as a mother has her children through egg donation and gestational surrogacy. And this is,
I just got news yesterday of a very dear friend of mine and somebody I treated who just gave birth
mm-hmm.
with a donor egg.
Yeah,
I mean, it was just, and she's perfect.
yep,
Gorgeous baby. Oh my God.
yeah,
It's just so precious, you know?
it is. It's incredible. Every
Yeah,
day it's a miracle.
it is. It is. 100%. So I want to thank you so much for coming on. And I also want to share with the listeners, how can people find you? And I'm going to also be putting the FertiCalm and FertiStrong in the episode notes
Okay, so
for people to find.
our centers in Boston, and the website is just domarcenter.com. So it's pretty easy to find me. And the apps each have their own website. So it's FertiCalm.com and FertiStrong.com.
Awesome. And then you have all your books in your website.
Yeah, plus they better be on Amazon and BarnesandNobles.com. I actually was looking at
that's it.
I think.
But can people find them all from your website?
Yeah, although I think I was just told that my first book, I think, which I wrote 24 years ago, I think is out of print. So, which is sort of sad, but I guess a 24-year run isn't awful. So probably the most applicable right now is Conquering Infertility, which I probably should update it because it was written a while ago, although it's mostly about the emotional impact of infertility and how to deal with that. And I actually think that that really hasn't changed.
Yeah, I think that, because as humans, we don't change that much. And if it worked then, it's going to work now.
Exactly.
So I really appreciate you coming on. This was a very enlightening and really interesting conversation, as I knew it would be. And I was very excited to finally have you on, because we've been working on this, but we finally got you on. So I'm really happy. So thank you so much.
My pleasure. All right. Thanks again.
So that concludes today's episode. You can find all the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to leave a review. Reviews are everything to podcasters. You can find me on my website at www.thewholesomelotus.com. And please be on the lookout for my online course and program. This course has emerged from everything that I've been using for the fertility program I now offer at my office. I wanted to consolidate all of my suggestions and coaching and put it into a form that anyone can purchase and use. It was important for me to encompass key fertility health factors, as well as guide you in implementing changes in your routine that are shown to boost fertility while being realistic and user-friendly. I will be offering this course with and without coaching. If you're interested and want updates, as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com, where you can find the subscription form. I thank you so much for listening in and hope you have a beautiful day